gentlemen, thank you for standing by and welcome to the FHWA Infrastructure Health Pavement Track webinar. Time all participants are in a listen-only mode. Later, we will conduct a question-and-answer session. Should you require assistance on today's call or like to ask a question, please press star then 0. As a reminder, this conference is being recorded. I'd now turn the conference over to Mr. Joe Gare. Please go ahead.
Thank you, Karen. A brief introduction remarks. I'm going to introduce Steve Gay from the FHWA Office of Asset Management.
Thank you, and thank you everyone for attending. The purpose of this webinar is to present the results of the FHWA Highway Infrastructure Health Assessment Pilot Study, specifically the results and recommendations resulting from the pavement track of the study. A separate webinar focusing on the bridge track will be held later this month. This study was performed in coordination with AASHTO in anticipation of what is now called MAP 21, having a performance management emphasis. Focused on determining the feasibility, benefits, and pitfalls of using several different data sets in an effort to determine the health of a specific corridor. The project FHWA had the input of many stakeholders, coming to a national meeting that was held this time last year in Detroit with representatives from 33 states and FHWA to review results and offer feedback. Provided a mix of chief engineers and pavement managers in order to share the results of this study with a broad audience. Division officers have also been invited. We are interested in interacting with you to attend the understanding of the project and the results and feedback on project findings, recommendations, with a focus on benefits, potential implementation challenges, and for addressing these issues. FHWA, welcome you. Hope you enjoyed today's informative session. And at this point, I'll turn it over to Joe Gare from Cambridge Systematics. Joe was principal investigator for the study. Your host this afternoon. Thank you.
So I will kick things off, and then at some point I'm going to pass it over to Jonathan Groger, who's with AMAC. And Jonathan was the project manager on the study, so we're going to be tag teaming the remainder of today's presentation. But before we get going, there's just a couple to note on the webinar. First, this is being recorded. Secondly, you see, hopefully everyone's seeing now the PowerPoint slides, and then you'll also see a series of panels that list the participants. It looks like we have about 56 now. There's a chat box. Throughout everyone by default, all of you are in listen-only mode, so you're on mute. There are options if you want to ask a question. We'll set the agenda up so that you'll hear from us, and then there'll be some time set aside for Q&A. If you'd like to participate in the Q&A session, there are a couple options. One of them is to hit *0, and we'll put you into our queue, into a Q&A queue, and our operator, Karen, when the time comes, will connect you so that we can hear from you. 2 is to, at any point in the presentation, you can type something in the chat box that you see on your screen, and we'll keep track of those, and we'll read those aloud when we get to the Q&A part. So you'll hear there basically 3 tracks, or 3 sessions of this presentation. I'll continue by giving you a project overview. We'll pass things over to Jonathan, who will go into a lot more detail on the findings and recommendations that came out of this study, with particular focus on pavement. So this is today we're focusing on the pavement track of the project. 2 weeks from now, we have a similar presentation The front end and the back end will be the same, but the middle will focus on the bridge track. After Justin's done, he'll pass it over to me, and I'll talk about another part of the project, which was a prototype health tool. I'll get a brief demonstration of that, and then we'll do wrap-up and final questions. One other thing is that there was throughout a couple of places we've asked a question, and so just to get everyone's some of that works, we have a very simple question now that Jonathan is going to display.
All right, Joe, thank you. Let me up our question. We just wanted to get everybody involved by clicking on your mouse and ask you where you're located. Keep this over a few seconds so we can gather results. All right, looks like we're getting close to the end. A few more people. Looks like we have a pretty, let me show the poll results. Seconds count for me. I think we're about split 50-50, 25 to 26. So that's a nice split around the U.S. So what I'm going to do is turn it back to Joe. Thank you, everybody, for answering that question.
Us are apparently floating along the Mississippi, which is good too. So Jonathan, you can give me control back.
Moment. All right.
Okay. So I'm going to continue on the project overview. Skye mentioned this effort was conducted by the FHWA, Office of Asset Management. The formal title, if you're looking for it after today, is FHWA's ability to assess highway infrastructure health. We started a couple years ago, and again, as mentioned, and at the time it was in anticipation of what is now known as NAP 21. And one of the tenets of the approach and of the work was to build off of and complement the work that was being done by AASHTO at the time, and still is, towards trying to advance some of the performance measures that were being considered for national implementation. There were two main objectives. The first was to develop a consistent and reliable method to document infrastructure health. And everything that you'll hear about and see today focused on pavements and bridges. That's what we meant by infrastructure for the purposes of this project. And I shall focus on the interstate system. But from the beginning, though, the idea was that develop an approach that could eventually be expanded to the entire NHS. The second objective was to develop the tool that FHWA could use initially and eventually state DOTs to provide access to this information. So understand and document the health and then provide access to that information. This we had two tracks, and I'll go through these in more detail in a minute, but the first one was to develop an approach for categorizing pavements and bridges, again, as good, fair, or poor. And we wanted that approach something that could be used consistently across the U.S. And in this context, the words good, fair, and poor refer solely to asset condition. And the second track of the study was to develop an approach for assessing the overall health of a corridor. And in this context, again, when we say health, we're talking about things that go beyond just the condition of the roadway. see some more examples of that later. And on here also we were thinking about, from a health perspective, we wanted to be able to look across state lines. So you could look at a corridor that crosses many states and get an overall sense of the overall health of that corridor. Phases of the project. The first one was to literature review and to develop a methodology. The second one, which you're going to hear a bit more about from Jonathan in a minute, is then we conducted a pilot along a 3-state corridor, the methodology. And then, as Steve mentioned, we presented the findings and recommendations at a national workshop, and the final project documentation. With the project, we had a technical working group that met a few times and provided feedback guidance to the work. We had representatives from a number of DOTs and ASHTO. And then, as you mentioned, we had for about at the national meeting, which was held in the ASHTO annual meeting in Detroit last year, there were about 33 state DOTs there in addition to FHWA and ASHTO. And later on, we'll show you, we'll give you to the documentation for this project, and also on FHWA's website, you can find the proceedings from that national meeting. Track number one, which was to define qualitative definitions for good, fair, poor. So let's start by just describing in words what we mean by good, fair, and poor. And the second step was, after we had those definitions, then let's develop performance measures that we can use to place the payments and the bridges into those buckets. And the benefits of this approach is there's a couple major ones. One of them was this approach. If you're just talking about now 3 big buckets, good, fair, and poor, it helps to alleviate some of the concerns and discrepancies in how data is collected, compiled, analyzed, etc. If you're talking about a good pavement, pavement should be a good pavement, regardless if there are some inconsistencies in how some of the data items are collected. The second big benefit was that the approach is flexible and it can evolve over time. So if we look in the definition of good, fair, poor, and hold that constant over time as some of the additional performance measures evolve and become ready for national implementation, then they could be used we could use them to categorize the assets into good, fair, and poor. So the table shows you the results of that step. This is basically, in words, what we mean by good, fair, and poor condition. Good, fair, and poor condition. There's 2 columns. One of them just talks about what the physical condition looks like. And so, for example, a good pavement is free of significant defects. And then the second column talks about what type of work is generally required, asset in that condition. One thing to read through this, I'll give you a minute to read through some of this, but it's important to remember that the audience for this table is us. It's technical transportation practitioners. There's been an understanding that if we are going to start to communicate this to the public or to elected officials, then we would need to revisit these definitions and seek more in terms that they can easily relate to. So next, the next step then was, once we have these categories defined, was to look at measures for evaluating the assets and putting them into these categories. For that, we built some work that was being done by ASHTO. And ASHTO also was looking at measures that could potentially be used for national implementation. they were evaluating them in terms of their readiness. How ready were they for implementation? And so they came up with these three questions. Is there no consensus on the definition of it? Is there an approach to data collection? And has there been some national comparative analysis done to look at the consistency of the data across states? And if there was yes to all of these, then, for example, it was categorized as a Tier 1 measure. And so if you meet these criteria, then it is it's ready for national implementation. I have on this table you see the goal area. Again, today we're just focused on pavement. We have a similar table for bridge, but on pavement we have the first table is the measures that were addressed through this is an HRP project 2024-37G that was conducted by AASHTO through NCHRP, and that looked at two measures, IRI as a Tier 1, and then a measure of structural adequacy based on HMS distress data. The idea behind that research is to the details of IRI for using IRI, and then to define an approach for moving that Tier 2 measure, advancing it. So eventually, someday, it could go into the Tier 1 category. So in comparison, at the bottom, we have a similar table now, but with the measure addressed to this study. The Tier 1 was an IRI. Tier 2, Jackson will talk about this much more later, which the Tier 2 measure was a functional condition measure based on IRI plus HPMS distress data. And then in addition, we added a Tier 3 measure, which was a structural condition that just combines the Tier 2 measure plus deflection data. So that was all track 1. Track 2 now looks at the health assessment. And remember, in this context, health goes beyond the physical condition of the assets. And the technology that we used a lot in was you can go into the doctor and you ask the doctor, what's our overall health? And so the idea is that they take your blood pressure, they ask you your age, your weight, et cetera, take some other tests, and the result of that is an overall assessment of how healthy you are. What you don't get out of that is a single number. Out of on a 100-point scale, the doctor doesn't say, well, you're about 82, or you're a 93, or whatever the case is. So there's no single algorithm that crunches these numbers, combines them together, and gives you a single score. Rather, the idea is let's provide the information to decision makers in a way that enables them to apply your judgment to it, make your own assessment of what the overall health of a corridor is. And from the data perspective, we wanted to try to do that with with data that's currently available. And then as we went along, as the discussions went along, and we tried to figure out and understand, in an ideal world, if you're trying to evaluate and assess and communicate the overall health of a corridor, would you like to see? And in those cases, we flagged some future enhancements in terms of data that we really like to see, but is not currently available. And then the good, fair, poor results that I mentioned from track 1, that one input and one key input into the assessment. But as you'll see later when I go through the demo of the health report, in addition to that, we layered on other characteristics such as the materials and the age, traffic volumes, etc. So we are our first Q&A point. I don't see anything on the chat box. Is that correct, Jonathan?
I don't see anything either. Correct.
Okay. So, Kara, if there's anyone who's in the queue, you can please start putting them through. Again, if you want to jump in here, feel free to type something in the chat box or hit *0, and Karen will put you through live.
At this moment, there are no questions in queue.
Okay, so Jonathan, let's move on, and you can take back control
All right.
for the next portion.
All right, thank you. So what we'll do is move into the next phase of this webinar and go into some detail about the pilot study results for pavement track. We're going to have another poll question, so you can use your mouse and click on the screen. Let me get up here. What I'd like to know is what data does your agency collect at the network level for the NHS? If state DOTs only could answer this, please. We're trying to get an idea of what we all collect out there. Well, a few minutes while you have a chance to answer. Looks like down a little bit, so I'm going to go ahead and close the poll. A countdown again, so I've got to wait 17 seconds. Joe, it looks like we're getting some questions in the chat box, but fortunately I can't see them, but I see them coming off the top of my screen. Do you see anything?
I do see them.
Okay, 1 second. All right, let me share the poll results. Looks like states are collecting IRI data and cracking data and running data and faulting data. Deflect data, only 43 reported collecting it. A lot of you are collecting M&R history and M&R cost, but less than actual performance data. So that information, that kind of goes with some of the experiences we've had with our pavement management efforts. So now let's close out the poll. Appreciate that. FHWA, it does not, but you should be able to close the panel on your screen. Move on now with the next part of the presentation. All right, again, it's Jonathan Groger. I'm with AMEC Environment and Infrastructure, and I was the project manager on this project. And at the beginning, the goals of the pilot study that were outlined for us by Federal Highway for pavement were to validate IRI as a Tier 1 measure. Joe talked about that earlier, the Tier 1, Tier 2, and Tier 3 measures. So one of the primary goals was let's look at IRI first, and let's see if that is a good measure for the National Highway System. And the second goal was to advance potential Tier 2 and Tier 3 measures. We wanted to see if we could any progress on advancing towards a Tier 3 kind of matrix there. Some of the key questions that we had were, did the data sets tell us the same thing? If we were to do this at a national level, what data sets should we use? And different metrics help us better understand pavement conditions. There's some questions. I have some more we'll talk about later on, but those were the key ones. To conduct a pilot study, we need to keep it fairly small within the scope of the study, within the budget that we had. So we selected a 3-state pilot corridor. We collected data sets from 3 sources. The first set at the federal level, or HPMS data. The level was at the state level, mainly looking at state pavement management data, but also trying to get an idea of some other things such as costs and construction history and that sort of thing. And also, the project team conducted field data collection on the pilot corridor using an automated data collection vehicle. We then compared all the data and measures resulting from this data collection and gathering process, and we identified issues and recommended improvements. And we'll get into all of these things in a few minutes. The corridor that we selected was I-90 through South Minnesota, and Wisconsin. Pretty much smack dab in the middle of the country there. You can see the graphic on the left-hand side where this occurs in the country. It consists of about 874 centerline miles, about in South Dakota, and the remaining mileage in Minnesota and Wisconsin. The range of pavement types. On the right-hand side, you'll see 75% 19% of the pavements were AC surfaced, or plain AC pavements, asphalt concrete pavements. 25% were composite, and then the remainder were Portland cement concrete pavements of one flavor or another. EDT ranged from 5,000 per day to 90,000 per day, so we had some rural and urban interstate. So pretty much a wide variety of traffic levels, urban rural conditions, and pavement types in this study. So national data gathering, we basically just collected HPMS data from FHWA, and then so for the states, we put a pretty heavy load on the state DOTs, and we do acknowledge the help of Minnesota, South Dakota, and Wisconsin in helping us gather this data. It was in a time where the states are really busy, so we really appreciate their input. The things we requested were documentation. We wanted to know what kind of data they collected, how they used the data, what their data collection protocols were, a whole slew of documentation. We requested inventory data, and the gist of it was pavement management data, and we were looking for structure, M&O history and cost, IRI, rutting, faulting, condition indicator, composite condition indicators that they use. For example, Minnesota uses a PQI, pavement quality index, a mashup of cracking and rutting and ride. So traffic data. And the reason structure and M&R history and cost is in red is we found that was fairly difficult for the states to help with. They had some, but we found a little bit of problem getting data in those areas. For collection, as I mentioned, the project team found used a vendor, Manley Communications, for the pavement data collection. The things we collected there were right-of-way imagery, rutting, faulting, distress. Again, a complementary data set that we received from HPMS and the states. So we processed the data according to HPMS 2010 standards for the entire corridor. We also did a PCI survey, or Pavement Condition Index survey, using ASDM 6433 on about 150 miles of the corridor to see what that told us. And it was conducted in the summer of 2011, so last year. And we contracted with ARA to perform rolling wheel deflectometer testing. The RWD, structural capacity at highway speeds, we also collected this around the same time as Manley was collecting their data. It was averaged to 1/10 of a mile. Put all this data, we took a look at the temporal consistency, or what data or time periods the data came from. The HPMS data came from 2 different years for the 3 states, but eventually we were able to get complete data sets from 2009 and 2010 for all 3 states. For the data, the PMS data represented conditions in 2010, and for field data collection, it represents conditions in 2011. We have a note here about the RWD results. The RWD requires pavement structure to do its calculations, and so Wisconsin didn't have that information. So the data you see here for the RWD does not include Wisconsin in it. You'll see no data part of the pie chart later on. So what are the detailed questions we were asking ourselves, and Federal Highway was asking us? We wanted to know how difficult it was to obtain each data set. We wanted to know the data was all from the same time period, which I mentioned previously a second ago. We wanted to see how consistent or complete the data collection between the pilot study states were. And we want the data were of similar quality, if the federal, state, and project team data was of similar quality. We also look at how do the various data sets compare. We also know which data set has potential for use in a national condition metric. Could we use pavement management data from the states? Do we need to use HPMS data from the Federal Highway? Do we need to go out and collect data on the interstates? That was one of the key questions. When we're looking at data, what are the necessary improvements we need to make to the data or the tools to national condition measure? What would a metric look like? How could we mash the data up to come up with an overall condition metric that represented field conditions? That's another question. And does the condition metric reflect what we see in the field? And one I haven't mentioned yet is we did, after we collected all this data and came up with all our metrics, we did do a ground truth exercise Simpson from our office and Nostrand Sadatman from Federal Highway took a little tour of the whole corridor with all the condition indicators that we had collected and did a ground truth survey. We all included some other Federal Highway people and some state people in that survey for parts of the survey. So we did ground truth exercise to look at how conditions were reflected there. So quick review of what our objectives were and how we went about collecting all the data. In a second, I'm going to go over our results, but right now we'll open it up to questions and answers. Oh, are you still not seeing anything in the chat box?
I'm still not seeing. I see only two things. One of them is a hello message from you, and then I typed in a test message, but I don't see anything further.
I'm not sure what's going on there. Karen, we can open it up to the phone lines. If you have a question, we can't see the chat box right now. So if you could dial 0 and ask your question live, that would be great.
Or is there are you seeing any chat messages that we're missing?
You can't see this.
I can't see your chat messages.
Okay.
There are questions that are coming in, though.
Okay.
If you just give me a minute. Looks like somebody hung up. Okay. Our question comes from Chris Bleach. Go ahead.
Is the presentation going to be posted anywhere so others within our department can view it?
We don't have plans to do that, but we can, the presentation itself, what we can do is if you send me an email, I can send it to you.
Okay. Earlier you said it was going to be recorded, so.
Just recording it for note-keeping purposes.
Oh, okay. You an email, you are who?
Jonathan Groger.
Okay.
I'm the one who sent you the invite, so yeah, if you send an email, I can get it to you.
All right.
Or eBay or Nostrand Sadatman from Federal Highway. Thank you.
Thank you.
See some.
I have no other questions here.
Okay. I cannot. I still can't see them, Jonathan. So
Because they were private. That's why they were.
got it. Okay.
Okay. All right. All right. Well, then. Once again, another set of poll questions for you. This will be a twofer. We have two questions.
Just one thing to point out. If you're entering text into chat box, there's a little drop-down list that says "Send to," and so you send it to the host or all panelists, then you can then we'll be able to see it.
Oh, right. Before we go on Q&A, I do have some questions in here that maybe I can address. They're coming. They're rolling in here.
Oh, great.
There's another one of, will this presentation be posted? Okay. We have a comment from Rick Miller. Remember that all NHS is not the same. NHS on the state-owned system is one thing, but local-owned NHS is different. Thought?
A good point, and I think it's one of the considerations. We focused on the interstate system, and then there was a desire to be able to roll out the methodologies for the NHS, but we did not get into the details of what that would look like or the issues that would be involved in that. But certainly appreciate the point.
Discussions that the index would be modified based on the type of the classification of the, or could be modified based on the classification of the highway. So the same health indexes will be used. The frame is the same, but the values for good, fair, and poor may change based on what type of it is, whether it's an interstate or a state route or whatever. Question: what was the ride data collected? Was it IRI? And that's correct. It was IRI. There's another question from Paul. Was there concern from the pilot states' HPMS coordinators that their data would be compared with other states? i.e. comparing one state's HPMS data with another may not tell a complete story as to why there are differences. Yes, when we have the national meeting, from the individual states themselves, what are you using this data for? How are you going to use it? You know there's limitations to this data. Also at the national meeting, when we gathered the 33 states together, that's one of the questions that we need to make sure that if we're going to do this comparison, that the data sets are the same and they're telling us the same thing. And yet later in this presentation, you'll see what we found with those data sets, and you'll see we found they are different depending on the data set that you use. So we understand it may not tell the complete story. Roy would also like, okay, let's take care of you there. So that was all the questions I had in the chat bar. Now I know how to use it. We will have that some more later on. So we'll move to the poll questions that we had. This will be 2 and 1. Open the poll. The poll is, do you think IRI can be used as a consistent and repeatable national pavement performance indicator? So that's our Tier 1 measure. And we just want to know if you think that could have the potential to be consistent and repeatable on a national basis. We all understand there's limitations that we need to get things standard a little bit more, but what do you think? And then second, what about cracking data? And it says on the screen we have a time limit of 5 minutes. That's a default, so I'm not going to let it stay open that long, but I'll go until it kind of stabilizes and then. All right, looks like it's sort of slowing down, so we'll close the poll. And it's going to give me another 7-second hold period. Almost. All right, so let me show you. Looks like most people think that IRI could be used as a nationwide condition indicator. 41%. Maybe that's a good answer too. We'll show you what our results were, but and what about cracking? So we're a little bit more pessimistic about that. Maybe and no sort of rule the day. And jives with what we found in this study. So let me close out this poll. Hopefully it'll go away. If not, it's not going away. All right, I get to close the panel. I don't know what's going on there. Refresh our memories. The pavement good, fair, and poor options that we were looking at were IRI, the function index based on HPMS data, which is the Tier 2, and structure condition based on RWD, matched up with the Tier 1 and Tier 2 numbers eventually, but we looked at it separately for this study. Each of these in turn. So we took all the data that we had, and on the left-hand side, you're going to see a graph of our AC. We looked at it separately for asphalt concrete and Portland cement concrete. And so on the left, you're going to see AC, and on the right, you're going to see PCC. On of each graph, we have field data, IRI in inches per mile. This is the data that the project team collected. And on the hand side, we have HPMS and state PMS data by numbers in inches per mile. And so we compared those. The green dots are the 2009 HPMS. The blue dots are 2010 HPMS. The little purple are the state PMS. And we put all this data together. We found the data lines up pretty well of this line of quality. So there's a pretty good correlation, or agreement, I should say, between the data we collected and HPMS and state PMS data. But one thing that jumped out of this were all these green cells up here, which were the 2009 HPMS data, which is always rougher than 2010 HPMS, state PMS, and the data we collected. And so our working theory is those were recent main rehab. Since this data represented 2009 and we were looking at this in 2010 and 2011, our is that this was some maintenance that was done pavement over that time because it's always rougher. On the side with concrete, we see the same thing. We see a few more outliers, but generally speaking, we've got good correlation between the IRI values, between data and the other data sets. If you're good, fair, and poor category, the data correlates pretty well, especially the 2010 state IRI and the 2011 field IRI on the left-hand column. They correlated pretty well. The data looks pretty good. You'll see later on that the data gets a little more squirrely as we look at different items. So we thought this was a pretty good between the different years and good, fair, and poor. Some of our observations were high from all the data sets are fairly well correlated, and theoretically any of the data sets could yield a good, fair, and poor. Also, the differences we observed between the data sets, we were in the realm of what happens when you look at, we had different equipment, different years, different years, over a series of years. So consider those factors. We felt that was a pretty good correlation there. Move to 2, advancing tier 2 measures, the functional condition index. We had IRI, cracking, faulting, and rutting. And to do the comparisons, we had to get all the data sort of into the same framework. And so we used the HPMS data set framework as our comparison mechanism. When we cracking length for asphalt, as here, the bottom is our field data collection length in feet per mile, and on the left-hand side we have HPMS data. For this particular set of slides, we couldn't use state PMS data because we couldn't translate that into HPMS data for a number of reasons. So we're just looking at HPMS data and our field data. So if you look at the slide, the data all sort of, for HPMS, is much more cracking in HPMS than we found in our field survey. So data did not correlate very well. But in 2009 HPMS and 2010, we had some decent kind of grouping of data, but we looked at the data and looked at the data, and we did not find very good correlation. When we look at percent cracking, again, we have field on the bottom and HPMS on the left-hand side of these graphs. When you look at asphalt and you look at concrete, there's no correlation there at all. This data is pretty poor in terms of matching each data set. For concrete, we found a little better correlation, but as you can see, it's spread out pretty good. It doesn't look as good as the IRI data, but you know, in the whole scheme of things, it wasn't so bad. And again, this is just percent cracking in the HPMS context. Look at something very similar as we in IRI. The data is grouped together pretty well. It has a good correlation among the group, but there's offset there, and when it's about a 0.15 inch offset connected, and we've started another study to look into that offset and see why that was. But I mean, this data has some promise. At least it correlates pretty well. It's just there's just an off shift there. There's a shift there in the data. Ooh, this was pretty all over the place. Blast, if you will. We had a really good correlation in between faulting data from field or HPMS, so that's pretty poor correlation there. We took all this data and we developed a functional condition index based on the results of the Amy and Osteron road trip along 90. We took that condition data that we gathered in the field, the engineer-rated pavement sections, and we created an equation that calibrated the data that we have from the study to those condition ratings. And when you do that, we mashed up IRI, cracking, rutting, faulting into this functional condition index. Now, we have some problems, but we did it just as an exercise to sort of see what we could see from doing that. We did that using these 3 data sets. We found that we get fairly wide variation from the HPMS data sets and the field data sets, where a lot of data in the poor condition for HPMS and not so much in the field, and we have more good field than we did in HPMS. So this is just a study, a little prototype to see what we could get out of trying to come up with a functional condition index. And this functional condition index says a long equation for asphalt, concrete, jointed concrete, CRC, that's included in our report, which we'll have the reference for at the end. See how we develop that functional condition index. Objective 3 was advancing a Tier 3 measure, and we wanted to try to begin to find the structural condition index. RWD was used on the entire corridor, and since we don't have Wisconsin data, we don't have results for Wisconsin. And RWD uses a sensor that measures the D0, which is the max deflection under the rear wheel, and a D15, which is the deflection 15 inches away from the maximum, or D0, maximum deflection, and collect at 15-meter intervals. No industry accepted method for using RWD to assign condition. We did literature search to see what states had done, and what we did was ended up selecting a study from Indiana to use in this study just to get good, fair, and poor. And that Indiana study, they used a D0 of less than 6 as good, D0 from 6 to 10 as fair, and D0 greater than 10 as poor. And you can see here that slots, in this good, fair, and poor graph here, it slots a lot of the pavements in the fair condition, and 2% in good, and not many poor, which kind of reasonable given it's an interstate pavement and it's a strong structure. So it was fairly reasonable results, but there's, at our recommendations later, we'll tell you what we think needs to be done with the RWD to make it more robust. Doing that, we decided, okay, let's look at IRI. Since we know IRI looks pretty good, IRI, and then let's look at results we achieved from the RWD and see how they compare. This graph is very similar to the other scatter plots we've been showing. For example, if this was well-correlated data, if IRI matched structural, those balls would be about the same size in the good, fair, and poor category. So diagonally across this matrix, they all be about the same size. And what we're seeing here is that the IRI versus structural condition paints a more conservative picture of the condition of the pavement surface. And it's been recently concluded from another federal highway study that looked at IRI and structural condition. So, a general observation here is IRI paints a healthier picture than, say, if you looked at structural condition for the interstate system. So, just observation, we didn't do a whole lot more with that. We just wanted to see what we could see by doing that. And a fairly interesting outcome. While we advanced, we also looked at remaining service life, since a lot of states are looking at this or do use this in their pavement management systems. And to do that, we use the Pavement Health Track tool, which I'm sure many of you are familiar with. If you're not familiar with it, the Office of Management has a web page devoted to it. You can download it and look at the technical specs and all that. When we used the PHT tool we were using HPMS data and our field data, we painted a very, very, very conservative picture of this particular corridor. And we looked at it in some detail and found that there was some, for example, the PHT looks at the age of the pavement as a critical condition indicator or a critical here. And a lot of pavements were very, very old, and so it was saying it was failed when it necessarily wasn't failed. But the bottom is the PHT tool painted a very conservative picture. We made recommendations to Federal Highway, and they're currently following up with that contractor to look at the PHT and see how it can be improved. Look at the overall good, fair, and poor that we came up with each of these different options. One issue you can make from this graph is, wow, I mean, it just depends on what you choose as your good, fair, and poor. IRI data at the top here, and we feel that's the most relevant data at this point, but the thing we tried gave us a different result, and so we could come to any consensus of two are kind of close. Maybe these two could be used. And there's still a lot of work to do in terms of figuring out how to slot these different indicators. Well, first off with the data, and then how to slot them into a good, fair, and poor category. Observations from the study. If you use the simple terms, the confidence levels in the different data sets, and again, using HPMS classifiers here, like cracking length and cracking percent, we have pretty high confidence in the data that we found for IRI. For percent, we don't feel confident in that data. The low medium, we feel a bit more confident in concrete cracking data percent, but not too much. I mean, cracking doesn't look so hot, and cracking length, pretty low confidence in that data. At all, there was a pretty good correlation between the data sets that we looked at. There was an offset that needs to be looked at, but rutting wasn't too bad. I think with that scatter shot that I showed earlier, we have pretty low confidence in that data. Sources, we found where HPMS section length may create a lot of issues with trying to come up with good, fair, and poor, or define good, fair, and poor, because some segments are 10 miles long, some are 1/10 of a mile long, and that's an average over 10 miles. So editing the data sort of takes out all the spikes, and it takes, kind of makes the data all go to fair. So something to reconcile these HPMS section lengths so they're comparable. And we're sure that just setting it at a certain length is going to solve that issue. But another project looking at HPMS section lengths to figure out what is the best approach for that. Because that would bias our data in some cases. Another observation is that data appear to be reasonable to use with some investigation of the offset, which I mentioned earlier. Cracking and melting data need closer examination from those data sets. And with structure condition, the RWD is sort of quite a black box at this point, and there needs to be some calibration standards, some data collection and processing standards. Everybody can see and kind of fill and get an idea of how all that processing is done. Also, RWD is very sensitive to aggressively textured pavements. So if there's any tining on the pavements or anything that gives it a texture, it has a little bit of a problem with that. So there's more to do with the RWD as well, opinion. So our observations overall, you could call them conclusions, but we'll soften it and call them observations. I feel that the project team felt and the participants at the national meeting felt that IRI, as it exists, is feasible for use as a Tier 1 good, fair, and poor raw indicator, and raw is emphasized because it's not a holistic condition. It really just measures ride quality, and so given the relations that we saw, we felt pretty good Tier 1 indicator, ride quality indicator. To make sure still that the data collection and processing is consistent. We know that different states process the data different ways. And the recommendation was, if this is used at a national level, that collection protocols be standardized, and so that the states can use them for this and for their PMS data collection, and the processing be consistent. For example, all of it should be run through ProVal. All of it should be using the same filters on the processing, and so there'd still be some improvements for IRI as well. And while it is not complete by a really complete picture of condition, the Tier 3 measures require significant work. We're just not ready for Tier 2 and Tier 3 yet. And there is some promise there because AASHTO and Federal Highway are initiating projects to move to the Tier 2 and Tier 3 measures to resolve the issues that we've been finding in this study. So Tier 2 and Tier 3 still have a little ways to go. We mentioned that rutting and cracking data could be used as a primary, or it could be used as a flag good, fair, and poor indicator. For rutting, you could just flag segments that were over a quarter inch of rutting or a third of rutting for a safety concern in the health tool. And for concrete, you may be able to use the concrete percent cracking as a flag to say, hey, you need to look at this. The IRI looks good, but you may need to look at this for cracking. So a couple things we can use. And faulting data cannot be used for good, fair, or poor. A lot needed there. Basically, the result of our study in a shell, and the report gives a lot more explanation about all these things and shows how we came to all our conclusions. But what we'll do now is, before we go to the phones, I'll scroll through my chat box here and see if there's any questions. Well, why don't we open it up, and while you're opening that up, I'll go through the questions and see if there's questions from the audience.
If you'd like to ask a question, please press star then 0 on your touch-tone phone. You'll hear an acknowledgement tone. If you're using a speakerphone, please use the handset before pressing the numbers. Just a moment.
Okay, Karen, there's a couple questions here. It's a comment, really. If we want to use IRI, we need a set of calibration sites all over the country and version tables for the different systems, or use the raw variation in inches per mile and not an index. I agree with the calibration sites. We need calibration, more QC and QA than we need more than less. So. We also talk in our report about using the raw data, and in our study, we requested the raw data from the states from HPMS and state PMS, and raw data from our vendor, and compared all that data. We processed the data the same way, and all the data came out very, very close to each other with proving it using ProVal, using one method. So, and it came close to what the states were reporting. So we felt pretty good that the raw data represented equivalent states, if you will, of condition. Karen, anybody?
Yes, we do. We have a question from Steve Halo. Please go ahead.
Published?
Is there any published?
Yes.
Yes, on the Federal Highway Asset Management website. We'll have that at the end.
Thanks.
Our call is from Andy Freedom. Please go ahead.
Entered on the cracking were well below the HPMS, and I wonder if that was an automatic or automated collection, and possibly if it was a 3D system that was ignoring sealed cracks. They're running the difference. Well, these questions may be in the report, so I guess I'd like to know that. But I wonder if it was a scanned versus a point setup.
Okay. Okay, this is the automated data collection vehicle. They used 2 cameras, and they manually extracted the data from the images. So, HPMS cracking criteria, so it's very straightforward, right? So it's just the percent crack with a length of cracking. So it's a simple process, really, of the cracking. And for running, they used a line scan system, I believe it was 4,000 points.
It was the LCMS, the INO LCRMS, and it's about 4,000 points for the transverse profile.
Then a question?
Yeah, the INO, comparing between lasers, I would expect the INO to have a little bit higher rut, showed a little bit lower, so that doesn't make sense, I guess.
But that's funny because we thought the same thing, and we're looking into that right now as part of another study.
Thank you.
There is a question that's coming across. Just a moment.
Okay, thank you, Karen. while that we're waiting for Karen, I'll go into the next question on that pod. Do you anticipate FHWA adopting the FCI formulas established in the final report as a measurement required MAP 21? Same weights for each of the criteria? The answer to that is no. Just a pilot attempt to try to get an FCI that we could play with and look at good, fair, and poor. There needs to be a lot of work done with FCI to come up with that procedure. And again, our last slide we'll talk about the other studies going on where we're looking at what items we should include in an FCI, how we establish good, fair, and poor, and working with a technical working group of state DOTs to come up with those values. Way to go, though. And it needs to get adopted by the states, too, so it's not like, I'm not speaking for Federal Highway, but I mean, it's not going to jam down anybody's throat without careful review and people on. Karen, what?
Yes, we do. We have a call from Dan Foe. Please go ahead.
Dan Sokolnicki with Michigan DOT. Hi. Could you expand a little bit on you had a noted concern in your findings or conclusion regarding HPMS section length possibly being a factor in with some of the comparisons you were looking at in the pilot?
Right.
We question here in the room about that mean potentially unique sectioning to run these types of comparisons, or something else. Could you expand on that a little bit from where you folks were coming from with that?
Sure. And maybe you can help me. Amy Simpson's on the phone too. She was a senior technical person on the project. But I'll start off. I mean, we're not looking to keep them consistent for any further comparisons. What we found was that the lengths that were delivered to us to review had a significant impact on the data. When we compared our field data versus HMS data, we had our data in, say, I'm just using an example, tenth of a mile increments averaged. And we compared that to, say, a segment in HPMS that was, for example, miles long. We saw that there was a pretty big difference in the data. And that the data lengths need to be standardized so that when you're looking in Michigan, it's as if you're looking at in California. And so if Michigan summarizes it, I meant to 10 miles, and California is segmenting everything to a tenth of a mile or some other increment, you're different results when you're trying to compare these two data sets. So it has a big impact on your good, fair, and poor evaluation. And we frankly don't know the answer to it at this point. There needs to be a study done to figure it out, and I believe AASHTO is doing that study right now.
You're referring that to when you're comparing a specific data piece itself. It would just look, the HPMS sections reported-wise, it's all the same section.
The HPMS sections are subjected to dynamic sectioning. That you get, there's some uniformity, right? And they in the pavement structure and in the way, it's not as much about the way the data is reported as it is making things making that you're representing the same thing across the interstate. But what happens with that is that when you look at an IRI, you might be looking at an IRI for a 100th mile segment, and then your next section is an IRI representing a 10-mile segment.
Yes, I understand that, yeah. All right, thank you.
Uh-huh.
Karen, do we have anybody else? Maybe talking to somebody else on the phone. Let me move on with the questions we have in the chat pod.
Jonathan, we should probably move on to the last section, and we can come back to some of these questions.
Okay. Good point. Thank you. Let me turn it over to you, Joe. Almost there. 1 second.
Just a few more slides, and then we'll have another period at the end to continue the Q&A. I wanted to talk a little bit about, give you a demonstration of the prototype health tool. And so I mentioned earlier that a couple things just to remember is that the area is that we're looking at ways to evaluate, assess, and communicate the overall health of a corridor, pavements and bridges. And we're not by not looking at a single number, but just by providing information to decision makers, to engineers, to trained professionals to look at that data and make their judgment and make their own conclusions about that. The thing to point out is that everything I'm going to show you is with actual data for the pilot corridor that Jonathan mentioned. And the analogy that another analogy that we're using as we get these, you're going to see a lot of data. I'm going to walk through some examples. Won't have time to go through detail through everything, but be aware there's a lot of stuff there that you're going to see on the pages. And one of the other analogies that we've been using is if you look at take a sports page analysis or analogy from a there's a lot of things there, and if you're not familiar with it, it can be overwhelming. You don't quite understand what's going on. It takes you a while to get into the details, but then that's constant. So every day, once you get the hang of it, you can pretty quickly open it up and get a sense for what's going on. So the other part to keep in mind as you see, because there's quite a bit jammed into the next following pages. So a couple things to look for throughout. We used a Rail Green model. Again, throughout the report, you'll see that there's these indicators there, and the idea is that it's just a very, very quick summary. If you're looking at a report and you see a bunch of green, then you can have some confidence that things are okay. If there's some yellow or some red popping up, the user's eye to them, encourage them to drill down into more information and understand what's going on. And all of these traffic signal indicators are based on fixed thresholds. So the data gets cranked through all of these thresholds, and the lights turn on automatically. Now, the other thing, in addition to that, you'll see in some of the screens some little flags, and so these things will turn. If something is flagged, it will turn red. So it's just right there, a red flag. Just take a look at what's going on there. Again, encourages the user then to on that piece of information and drill into more detail. An example of that is that if more than 5% of a corridor has an IRI above an extreme value, then it would get we called it an extreme value flag, and then flagged, and then it would tell you why the flag was there. So what I'm going to show you on the next couple slides are screenshots from this prototype tool, and the concept was that this is both essentially it's a system, it's a tool that sits on and you can access on your desktop. But then also that when you pull out ports, you could print them out, and you could have hard copies. So it's could be a hard copy report also. The next screen's function is both of those concepts. The first one at the top here, you see we have the report type. We call this the dashboard view, and essentially this is just a map of the pilot corridor that Jonathan mentioned, going through 3 states. Here the segments are color-coded, done good, fair, poor, using IRI. And the idea is that this map eventually it would be interactive, so you could go in and zoom out, and if you want to look at a specific length of a corridor region, or for a state, or for multiple states, whatever the case is, you'd use this interface to identify what corridor you're interested in. And then at the bottom, there's just some basic information. So by functional system, urban, rural, the number of lane miles, the bridges, some traffic ranges, etc. Some notes about where the data came from. Again, it's all HPMS data and MBI data. And then aside, we have some very high-level results. So the overall for this corridor gets a yellow light. Then you see the breakdown of good, fair, poor there. And under that, you see some lighters just for pavement condition, which is a green, and you'll see more on why that gets a green on the next slide. And then bridges where it got a yellow. Both in terms of the distribution between good, fair, poor, and the ages of the bridges along those course. And in addition to that, at the bottom, in the bottom corner, you see the red flags, and we have a description of those in a couple slides. But the point here is that this corridor didn't raise any of the flags. So pretty quickly, by looking at this slide, you can see this is the corridor that we're looking at. Looks like pavement's in good shape. Some concerns with bridges. That's where they're yellow. And if you combine those two together, then it got an overall yellow light for infrastructure health. I'm going to move into, we called it the summary page. Now, this is one of those pages where I mentioned where there's just a lot going on. Some of the highlights to you. First is to the left-hand side of the screen is all pavement. We have 4 panes that have to do with pavement condition. The right-hand side is the mirror image of that, but for bridges. So about half and half. And then at the top, we have some summary statistics, a little bit more than what you saw in on the first screen. Just again in terms of the climate zone, traffic volumes, truck volumes, number of bridges, number of SD bridges, et cetera. Just a number of statistics that would be useful when you're trying to understand what's going on in this corridor. Then, at the top, we have a pie chart of good, fair, poor. This came right out of what you saw previously from in the presentation from Jonathan. This was, we're looking at it by lane miles, but the idea here is that you could convert this pie chart to see distribution by VMT. And given the distribution, it was flagged a green light. Underneath that, we looked at pavement condition history. So we looked at 2 data points. What did the distribution between good, fair, and poor look like in 2004, and what looked like in 2010? If you compare those side by side, you see roughly the same amount stays in good condition, and then the poor creeped up a little bit. In the next pane, we have a comparison of the corridor to a national average. So the corridor is all on the interstate system. So we have 2 lines here, one for IRI, for RSL. I'll talk about RSL in a minute. IRI, the red line is the range of IRI values for the corridor and the mean value. And then is that same information for all interstates in the U.S. We had about doing the same type of comparative analysis for remaining service life, but the data was not available, so we flagged that on this prototype report as something that we'd like to see going forward as an enhancement. And then just one more view at the bottom here. This is looking at the corridor by milepost from west to east. So there's a couple different dimensions here. As you go along, again, you see the good, fair, poor, using output directly for analysis that Jonathan described. And that's the color code. You also see that on this axis, you see the traffic volumes. So one of the things that you can pretty quickly, once you get your bearings on this chart, understand is that there's a lot of green where the traffic is at the 2 peaks. Some yellow here, and then there's a little red spike up here.
Joe, sorry, I'm not seeing your cursor.
Oh, okay, sorry. Look at if you draw your eye to those peaks, you see that that's where traffic peaks, and largely those are peaking in green areas. The dimension that's flagged here is those gray bands that you see, and those are the urban areas along the corridor. And no surprise that the traffic tends to peak in those urban areas. So the equivalent of everything I just described on the left-hand side for pavement is you'll see the equivalent of that for bridges. Techniques, same graphs, but they're focused on the good, fair, and poor, the sufficiency rating, and the age. Now, then there's one more level of detail. This is number 2. One more level of detail is on the next page, and this is now looking at, this page is just for bridges. I have a very similar sheet on the next slide that's just for pavements. What you see here on the left-hand side is the distribution of condition ratings compared to the national average. So on that, in the far top left corner of the report, you see deck condition rating. That's MBI deck condition rating, which ranges from 0 to 9. And you see 2 lines. The red one is the corridor, and the gray is the system. And by system, we mean an equipped system, so this is all interstates in the U.S. And you said it matches up pretty closely. In contrast to that, if you look 2 graphs down at the bottom there, still on the left-hand side, you see the graph for bridge age. Now here, this is one of those instances where you see the corridor spike, the bridge age category relative to the national average for the interstate system. So this is one of those areas where while a yellow indicator for bridge age earlier in the report, and if you then would look into and dig into more information and more detail on what's behind that indicator, you could find this graph and understand that the bridges in this corridor happen to be a little older than what we expect looking at the interstate system. On the inside, we have 2 panes. One of them is just a list of the lowest average condition rating. So what are the in this corridor? Just we listed the 10 worst the bridges in the 10 worst bridges, and then underneath that you see a description of these red flags. On the first page, if we would have seen a flag highlighted in red, you could to this screen and understand what that flag is indicating. For example, on the first one says, the corridor does not show a significant decline in bridge condition compared to 5 years ago. If it did, then you would first flag turned on, and it would be red. And the last slide on this is the same idea, but now we're focused on pavements. And you'll see we're missing some data on the left-hand side. The thing that we had for comparative purposes was IRI, and you see that in the top left. For cracking and redding and faulting, we did not have that for the entire interstate system. And then a couple other areas, again, that were flagged in our conversations and discussions about things that would be really useful to be able to see in this way were the remaining service life, which Jonathan mentioned, and then the expenditures. And on the right-hand side, it's the same thing, segments with the highest IRI, and then red flags, and again, there are no red flags. A corridor. So that's a quick demo of the health report that was developed as part of this project. I don't see any chat discussions, but if you please let me know. And then otherwise, Karen, we're open, also ready to take questions again.
Okay, we do have a question from Andy Freeman. Please go ahead.
Answered our question for us. Thanks.
All right, so a question related, sort of related to the health tool from couple people. So is there any thought, the question is there any thought for considering level of service as part of pavement health? Smooth pace as long as you're moving down the highway. Joe, do you want?
So do you want level, so there's is level service, or you're talking about the capacity level of service?
Right.
Okay. So one of the, that's a good question, and one of the things that one of the ideas that went into the design of this report we mentioned was that looking at health from a physical condition perspective, and I mentioned that it goes out beyond condition, such as the age and materials, et cetera, and looking at how the condition matches to traffic volumes. But there's a desire to draw a line between the physical condition of it and then the service and the functionality of the assets.
Right.
So,
in the national meeting, we had a long discussion about that. Like, for example, if a bridge can't carry the capacity or the highway can't carry the capacity, and the participants in that conference were okay with separating those two things, but eventually they commented they need to come together. So it's a very good point.
Yeah, that's right. And for the same reason, we didn't highlight functionally obsolete bridges either. But there was discussion where, on top of this, now if you have this as the base, the condition data as a base, you could layer on things like the level of service. You can where accidents are and look for accident hotspots. So you could build, if you think about this as being the base of a health report, you could continue to layer on additional dimensions.
All right. And that's all we have on the health report. We do have a couple more questions back to.
Okay.
Hey, we can take that in a minute.
Okay.
Well, excuse me. Do we have anybody else?
There are no other questions that are queued up.
All right. And so we'll just close this out. Well, not close it out. We're going to have a couple more questions here, but just wrap up the presentation piece. For more information on what we've done here and what Federal Highway is doing in this area, if you go on to the FHWA Asset Management site, and if you just type that into Google, you'll go right there. And the URL is right below that. But if URL and then you go to pavement applications, the pilot study report will be, at least as of yesterday, the pilot study report will be number 1, and national meeting report is number 2 in the publications list. Right there. And I've alluded to this throughout the conversation today. The Office of Asset Management is taking the results of this study, and and not just the Office of Asset Management, but also AASHTO are getting the results of this study and other studies AASHTO is doing, and starting to look into these details. For example, their Tier 2 index study now, trying to see how we can combine distress and IRI. And it starts basically with data collection. But we're going with the Tier 2 index. With fall, Highway is looking at resolving that offset, see why it occurred and how it can be prevented or ameliorated in the future. And then we're also looking at, Federal Highway is also looking at performing something similar on additional corridors to see if the hold out. I have I believe one more question back to the pavement piece of the presentation, and maybe 2. Let's see. I guess it's a agree IRI is feasible for the interstate. You didn't look off interstate in your study. Can't draw this conclusion to low-speed roads. Totally with you. The scope of this study, we'll look at the interstate and NHS, and we realized that once you get off the NHS, then you've got other issues to look at. But the health index should, one of our things we discussed during the project, the health index should be the same kind of road you're on, but maybe the categories of classifying did change. The good, fair, and poor might change in terms of how you classify that. The question was, HPMS, PMS, and field data collection summarized on the same section limits? And that is yes. And that's where we found that issue. It was summarized to the HPMS section limits because we expand our field data collection and we could expand the state data collection, still an HPMS segment, but we couldn't chop up the HPMS segment to compare against state PMS and our field collection. So we had to use the HPMS segments as our base for all comparisons. That, I believe, those are all the questions. Do you have anybody else on the line?
No, we do not.
All right.
Excellent.
Thank you very much for this presentation. I'd like to thank all the participants, and I'd especially like to thank South Dakota, Minnesota, and Wisconsin for all the effort and work with you on it.
Absolutely. They did do a lot of good work on this.
I realized up front where I thought sometimes this would be easier to do than it ended up being. So, once again, thanks for everybody. For weeks to be another similar web presented on bridges, and FHWA Office of Asset Management is trying to address these issues, so we're prepared to move ahead and advance the state of the practice. Any closing comments, Joe?
Yeah, I'm good.
Very much.
Thank you, everybody. We appreciate your time.
That does conclude our conference for today. Thank you for your participation and for using AT&T Executive Teleconference. You can now disconnect. Speak if you'll stay on the line, I'll move you back.
Thank you.
Thank you.